Hello everyone, I am Divya, your host, and welcome to today's FB Live session. Well, if you are Indian origin living in US or your parents are flying from India to US, then you do not need to worry about the medicine. eGlobalDoctors has your back. They have different packages for you, starting from $199, which will give access to 300 plus doctors with 40 plus specialties. Prescription will be provided, video consultation up to 30 minutes. You can join the live via video physician consultation from any part of the world. ID and health passports are also available. Also, eGlobal Doctors have started a new diet consultation as nutrition and health. Our holistic nutrition coaches will help you to reverse the chronic diseases and you will live a happy life. You can register yourself at eglobaldoctors.com. In today's session, we will be exploring and providing more information about a very concerning topic, especially for everyone, that is the hair problems and the solution. For today's topic, we have our eGlobal Doctors expert dermatologist, Dr. Lata Rijhwani. She has done her MBBS from Udaipur and post-graduated from UK, and she also practiced dermatology in Kuwait. Recently, she is residing and practicing in Jaipur. So without any delay, let's welcome Dr. Lata. So how are you, ma'am?
Thank you so much. Thank you for the introduction and for having me in this platform. I'm very good. Thank you.
Nice to have you back, ma'am. This is a very hot topic for everyone. So let's start with our very first question. So how one can identify hair problems?
Patients, they are very much, mostly they are aware, and hair is such a thing that you cannot ignore it. And so most of the times, patients do come with different hair problems. And when you said identifying the hair problems, let me talk about what are the common hair problems that one can face. So the most common is hair fall. And male or female, everyone is, at one point of their lifetime, they will be having hair fall. So hair fall is one, and I'll talk in deep about how we can identify significant hair fall. But then there are different types of hair fall. And then sometimes the changes in texture of your hair. Sometimes people complain of too much oily hair or dry hair, brittle hair. You can have dandruff, which is again very, very common problem in all the age groups, I say. Then there are certain infections one can have, bacterial infections, fungal infections. And then, of course, there are many other, like hair shaft anomalies and different types of hair problems. But most of the times, since the hair is a thing that is so much visible, it's you cannot ignore it. And most of the times people are easily they identify what's going on in the hair, on their hair.
Okay, amazing. Thank you, ma'am. So let me remind to our viewers that we are live on FB as well as on Instagram. So you can jump on your favorite social media and get to know more about the hair problems and solution with our experts. So my next question is, what are the main causes of hair problems or loss? Like what health issues can cause the hair loss?
Coming to the causes, I'll just talk about the most common problem first, and that is the hair fall. And apart from the hair fall, as I told you, there can be premature graying of the hair, which is also a very, very common problem nowadays, especially the teenagers. Surprisingly, they are coming up with early graying of the hair, and then there could be infections. And so, talking about the causes of the hair fall, the most common cause is stress-related hair fall, and telogen effluvium is a very important cause, and it should be on the top of the list. I'll talk in detail about what is telogen effluvium, and then nutritional cause is again very important. And after that, there can be some hormonal issues which we'll talk about in details that can cause hair fall. Then there are some genetic disorders. There are some autoimmune problems that can lead to hair fall. And if I start with telogen effluvium is a condition in which either the hair, it is, post stress, it is a condition in which if your body undergoes a stress of any kind, whether it is a post-pregnancy stress, it is a nutritional stress, or you will have some prolonged illness like malaria, typhoid, and then, for example, COVID was, so much when people were having COVID, they had this hair fall. So in telogen effluvium, when your body undergoes any kind of physiological stress, after 2 to 3 months of that condition, the hair is falling a lot, and the patients usually come with, significant hair fall. And then nutrition is again a very important cause, and especially iron deficiency. If I talk about in females, it is again, especially in our Indian population, it is a very common cause of hair fall. And apart from iron deficiency, the other micronutrient deficiency, vitamin B12, vitamin D, and zinc, these are all also very important causes of hair fall. And then hormonal issues like people, especially females who are suffering from PCOS, polycystic ovarian disease, and thyroid is again a very important cause of hair fall. Thyroid issues, whether it's hypothyroid or hypothyroid. Yeah.
So there are many different causes like stress and nutritional.
Yeah.
So thank you, ma'am, for that. So my next question is, should one change their diet or hair care routine if they are facing hair problems?
Yes, of course, diet plays a very important role. See, when a patient comes to us with a, first of all, let me tell you that how a patient will know that this hair fall is significant. If I talk just about hair fall, which is primarily the very important cause of our, visits to the OPD. So sometimes, 50 to 100 hair per day a person can lose. But I will prefer, like it is very difficult for a person to label whether I'm losing 50 to 100 hair. But most of the times when you notice that your hair is getting thinner, it's losing its volume, and when you wash your hair, you can see your hair everywhere in the washroom and on your pillows. And for the females, you can notice that either your parting is getting wider, your ponytails are becoming thinner, and for males, if you have that receding hairline, or sometimes your crown is visible, so you can just you can just label it as, okay, something is really going wrong with my hair, and then you can approach your doctor. And it is very important to ascertain the cause of hair fall. So if there are certain investigations that we can make, and when you take a proper history of the patient, you come to know that there are some, especially in the teenagers, when they come to us with premature graying or hair fall. And teenagers, they're very conscious about their weights, and most of them, they are doing crash diets, and they're not taking care of their nutrition. So then you come to know that there is something wrong with their diet. And as I would say that hair is structurally, it is made up of protein. Like protein is the building block of our hair. So talking about the diet, protein should be the most important, constituent of your, of course, you have to eat balanced diet, but then protein, foods rich in omega-3 fatty acids. This is also very important. Then biotin, pantothenic acid, and other micronutrients like zinc, vitamin D. And, everything has to be taken care as a whole if you need a nice, lustrous, shiny hair. So yeah, you have to, and your other question was the hair care routine. So let me tell you something about your hair care routine. As I would say that go for minimal products for your hair. And I am still of that old school who thinks that regular oil massage of your hair twice a week with a lukewarm oil, and my most favorite being coconut oil. You can go for that. It is good for your circulation. It is stress relieving. It conditions your hair. And so twice weekly prior to shampooing, 2 to 3 hours should be good enough. Use a mild shampoo and preferably a sulfate-free shampoo so that your hair doesn't dry out. And twice weekly should be good enough. Unless you're working in an environment, you're too much sweating, you have particular hair concerns, twice weekly should be good enough. Use a good hair conditioner, and do not use harsh chemicals, hair styling products, hair styling appliances for your hair. Minimize those. and don't undergo various treatments which are now getting very popular, like keratin, coloring, bleaching, and rebonding. So if and follow a good diet. So I think these minimal changes in your routine would go a long way with having good hair.
Okay, so as the doctor mentioned, viewers, you are listening that we need to care of our routine and the nutrition also. So, viewers, eGlobal Doctor is one complete healthcare platform solution for all your medical related issues and questions. And मजे की बात ये है that you have these services available to you at your fingertips without breaking your bank balance and without driving all in the comfort of your living room. So, ma'am, as you mentioned that stress and iron also causes hair loss. So, does lack of vitamins also causes hair loss?
Yeah, as I said, that when a patient comes to us who is having a significant hair fall, we tell them to undergo some investigations, and so vitamin B complex, and especially the people who are on pure vegetarian diets, vitamin B12 deficiency is usually seen very commonly. So this is one test that we order. Then vitamin D deficiency is again very common, and it is very important from our, like a hair health point of view also. So, and of course, the complete vitamin B complex is very important. So there are some tests that we order to find out whether there is some deficiency to be corrected. And then we supplement those along with our other, treatments.
Okay, that's great. So, viewers, we are live on FB as well as on Instagram. So, join us to know about the solution for hair problems. And let me tell you that eGlobal Doctor has nutritional coaching for reversing your chronic diseases. So, you can check the plans on eGlobalDoctors.com. So, moving to the next question, ma'am, I wanted to ask, like, how many times a week we should wash our hair? Does washing also affect our hair loss or problems?
Yeah, as I told you, twice or thrice weekly should be good enough. But again, some people do have very oily hair, and twice weekly is not enough for them. Sometimes they have some specific hair concerns, like they have a lot of scaling, so they can wash it more often. But it is recommended that do not over wash your hair, because not only that, it strips off the natural hair oils, it causes brittle hair, it causes split ends, and frizzy hair. And if you are not using proper shampoos, or some people they keep on experimenting with products, it might do harm to your hair. So limit your hair wash.
Okay, so
Do
we
not.
have to limit our hair, otherwise it will cause some hair problem. Okay, so can hair regrow after the hair fall?
Yeah, this is a very good question, Divya. See, as I told you, telogen effluvium is a condition in which, see, what happens is that your hair cycle consists of three phases. One is the anagen phase. 80 to 90% of our hair at any point of their time, they are in anagen phase, that's the growth phase. And 10%, around 10% of our hair, they are in shedding phase, that is known as the telogen phase, to make it very specific and clear. So what happens is when your body suffers any kind of shock, so all the blood supply of your body and nutrition gets redirected to the vital organs, and your hair doesn't get enough nutrition, enough oxygen, even enough blood supply. And so what happens is most of your hair, which were in growth phase, they are redirected to the shedding phase. And that is how, after 2 to 3 months of any illness or any surgery or post delivery, patients do come to us with a significant hair fall. So this condition is labeled as telogen effluvium, which is a very common cause of hair fall. This hair, first of all, let me tell you, this hair is completely, it comes back, because once the condition, it subsides and you take care of your nutrition and we prescribe some serums and all, it is completely treatable. And as long as your hair follicles are intact and they are healthy, there are 100% chances that your hair would regrow. So first thing that we reassure our patients, yes, there are certain conditions, especially cicatricial alopecia, in which you have patchy hair loss where there is, scarring when your hair follicles are damaged completely. For example, if you have a trauma, you have an accident, you have a scar, there was a burn, or there are some congenital conditions in which you have birthmarks where the hair follicles are missing. That place the hair won't grow back, but otherwise, most commonly, whatever hair fall we see, most time, and again, very important, the earlier you approach to a dermatologist, there are fair chances that you have completely normal hair back again.
Okay, that's a very wonderful information. Uh, our viewers are getting so much information, and I did not know about that. So my next question is, like, how one should improve their hair health? Like, you have talked about the nutrition and diet thing. Apart from that.
Yeah. See, as I told you, if you follow proper hair routine, you are having a balanced diet and incorporate any type of exercise in your routine, exercise, yoga, meditation, which not only improves the blood circulation. See, it is very important that your hair gets nourished from inside, because whatever things you are using from outside, there are so many products, markets are over flooded with products of hair growth, hair oils, but I believe that whatever stays in your hair for 4 to 5 minutes is not going to change your hair, it's not going to do a magic. But if you take care of your diet, you follow proper routine, and whenever you find that there is something which is not, like people have dandruff from years, they have loads of scales and they are just carrying it simply that ye to hota hi hai. But this should not be an attitude, because anything that is unhealthy on your scalp, that can lead to hair fall and many problems. So whatever thing that you find is abnormal on your hair, just go to the dermatologist right away. Don't wait for it, or don't use home remedies, or like I am not the one who will suggest that. So take properly treatment, take care of your diet, and as I said, use minimal products for your hair, which are of good brands, and then I don't think you'll have nice hair for a long time.
That's great to know. So, as we all know that prevention is better than cure. So, how one can prevent their hair loss or gray hair?
Yeah. See, I did not talk much about premature graying, and it is getting so popular. Before, we used to get people who were in their 30s and 40s, and still they used to complain about that they're having gray hair. But nowadays, we are seeing children 12 years onwards, they are coming to premature graying. The reason being that, as I said, stress again is getting, in whatever disease you talk about, there is a lot of physical stress, mental stress, and the diet is improper. Children especially, they are relying more on junk food and all. The green vegetables are totally missing from the diet, so incorporate more of green vegetables, proteins. If you are a pure vegetarian, you can eat paneer and soya bean. You can depend on sprouts, all kinds of pulses, kidney beans and all. If you are a non-vegetarian, chicken, fish, egg would be very nice for your hair. So take proper diet. And then other factors like free radical damage caused by pollution. There is excess pollution, sun exposure. Smoking is another very important cause of premature graying. You can see teenagers coming with lots of gray hair. So if you have, as I always in all my talks, I say, if you follow a healthy lifestyle, that will be preventing so many problems of skin as well. So to teenagers especially, eat home cooked food at least 6 days a week. Green vegetables should be there. Egg is very good for the hair. Nuts and seeds would be very nice, which are very rich in omega-3 fatty acids, and very important to give shine and luster to your hair as well. So, and then very important, if you have premature gray still, gray hair, don't just ignore that, oh, they are not going to come back. And, of course, most of the times they are genetic, but then before it used to start in late 30s and 40s. So come to the doctor. There are many medicines that prevent premature graying, and that will also stop and the graying of hair. And also same goes for hair fall also.
Viewers, you are listening to Dr. Lata. So you have to build a healthy lifestyle, and you can anytime consult if you have any hair problems. So, like as you mentioned about when to see the doctor. So, if someone is facing hair problems, like if I'm having so much hair loss? When should I know I have to go to the doctor?
Yeah, talking about hair fall again, hair fall itself is a very long topic. I can go on talking for hours on that. So, see, there are two kinds of hair fall broadly. One is a diffuse hair fall, that you are losing your hair diffusely and you are not noticing it all of a sudden. Then some people, they have a patchy hair loss, like many times when they go to the barbers, they notice that they have those point shaped patches in their hair, which is a very common condition also, especially in children, which is known as alopecia areata, in which you lose hair in patches. And so suddenly you notice that you have a patch of your hair, and such patches can be there in your eyebrows, they can be in your eyelashes, and for males it can be in your beard area also. So alopecia areata is an autoimmune condition. It is very common. But again, people try home remedies, some remedies prescribed by the barbers until they come to us. So what I would say is that as soon as this condition is found, come to a doctor for a proper diagnosis and treatment. And about talking about the diffuse hair fall, as I said, sometimes people they don't notice unless you have very thin hair, and people start telling you, oh, you have got some diffuse patch, and females they notice that due to age or due to some hormonal issues. So as soon as I mentioned before, you notice that it is getting significant, you are finding hair everywhere, your ponytails and braids are getting thinner, that means you need to see a dermatologist so that your hair can grow back completely with proper management and diagnosis.
Okay, so viewers, if you're facing any hair problems or skin problems, you can consult anytime from anywhere with your mobile or laptop to our expert Dr. Lata on eGlobalDoctors.com. eGlobal Doctor has a variety of featured categories as diabetes remission, detox program, weight loss, child nutrition, gut health, menopause nutrition support, and reversal of PCOS. Our holistic nutrition coaches will help you to reverse these diseases. And they have 3 months and 3 weeks plan are available for you. Register with us today at eGlobalDoctors.com and book your appointment to get a proper nutrition coaching for your health problems. Also, you will get the 2 free nutritional assessment. So what are you waiting for? Go and register yourself now. So thank you so much, Dr. Lata, for providing such useful information about the hair problems and the solutions. Thank you, ma'am. So it was a wonderful session with you. Any words for viewers?
Yeah, thank you, Divya. It's very common, complaint of the patients and everybody. Most of our OPD, especially the females, they are, So I hope that this session, gave them some insight about the hair problems. And if the viewers have any question, I'm ready to take them. And we didn't talk about the treatment. So Divya, I'll give a nutshell about what do we do when a patient comes to us with a hair, complaint of hair fall. So first of all, we identify the cause, which is very important. Like simply, you cannot go on putting things without knowing what is causing your hair fall. So once you come to us with proper history and with examination, we do a hair pull test. We do dermatoscopy, and with proper diagnosis, we identify the cause, and then we try to treat the cause. There are many hair supplements which are available in the market, which are prescribed. Then we have hair serums of different kind, which are having certain components that are specifically address your hair concerns. Sometimes when you have issues like dandruff, we are prescribing different types of shampoos. And of course, when such things don't work for hair fall, there are some minimally invasive procedures like mesotherapy, in which a cocktail of vitamins is instilled in your hair. Then we have PRP. There are different laser therapies that can be done for your hair regrowth. So this is all depending on what type of hair fall or hair issues do you have. If you have infections, then there are different medicines, oral antibiotics, topical antibiotics to address those. There are fungal infections, especially very common in children, and those are again treated with different. So there are different, problems of hair which can be treated differently. So this is short about the treatment.
Yeah. So, ma'am, we have one question on FB. Does hereditary play a role in hair fall?
Yes, it does play a very important role, especially in the androgenetic alopecia that in commonly in lay terms we call it baldness, like male pattern baldness and female pattern baldness. There are two. And of course, these conditions, they are, genetically determined to a great extent. And like, for example, when the males, they come to us with who are having early baldness, most of them, they give history that their fathers and their brothers or their uncles, so heredity does play a role not only in your hair fall, but the type of your hair, whether you're having oily hair or you are having dry hair, you're having curly hair, you're having gray hair, like everything and anything can be linked to genetics. Yeah.